The news today continues here on One News Now. I'm Jess De Los Santos. The Octa research team reports a downward trend in the COVID-19 infection rate in the past week. But the health department warns that this might just be an artificial dip, as some testing labs did not operate during the Holy Week. Greg Gregorio has the details.
Experts have seen a slight decrease in COVID-19 infection rate across Metro Manila 2 weeks since stricter quarantine restrictions were enforced in the NCR Plus bubble. The Octa research team says that from 1.88 2 weeks ago, the reproduction rate went down to 1.61 this past week.
Meron talagang positive effect yung ECQ natin, even ng GCQ. Pero nung time ng GCQ bubble, nag-improve by 0.1 yung reproduction number from mga 2 to 1.9 approximately. Pero with the ECQ, nag-improve siya from 1.9 to 1.6. Ibig sabihin yan, yung trend is slowing down. Or if kung compare natin kunyari yung growth rate, 1 week growth rate, nag-decrease siya from 60% increase to 20%. Ang ibig sabihin yan, yung number of new cases natin this week, mga 5,500, it's only a 20% increase from last week. Sa NCR yan, yung 5,500. So nag-i-improve siya, and hopefully with the additional 1 week of ECQ, we can reduce further the reproduction number. Sana mapababa natin to 1 or close to 1. So yun yung gusto natin makita this week with the extension of the ECQ.
Octa says that in the worst case, COVID-19 infections in the country could reach 1.2 to 1.3 million by the end of the month. They are hoping that this won't happen, especially as the enhanced community quarantine in NCR Plus has been extended for another week. For its part, the health department warns that the decline could be artificial because up to 70 testing laboratories did not operate during the Holy Week.
The virus spread has not slowed down yet. Tama po yung sinasabi naman ng Octa Research, no, na talagang we have anticipated that for these coming days, medyo mababa ang maitatala natin ng mga numbers because some of the laboratories did not operate. It is too early to say for us to analyze and say na nag-work na yung ECQ.
Aside from this, the DOH sought the help of the World Health Organization to investigate how the B117, B1351, and P.1 variants of the SARS-CoV-2 affected the trend of cases in the country.
Gusto natin mas maintindihan pa kung ano yung epekto nitong variants, ano yung level of transmission dito sa ating bansa when it comes to the variants. At saka gusto natin magkaroon ng guidance or technical assistance from WHO on how we can better manage, no, na meron na nga tayong ganitong variants dito sa ating bansa.
The health department will also be seeking points on how to improve its biosurveillance system to see the real picture of the pandemic in the country due to the existence of these new variants. For News 5, Greg Gregorio, we are One News.
Some private hospitals are reportedly unable to accept more COVID-19 patients, partly due to the unpaid claims of PhilHealth. PhilHealth spokesperson Ray Balenya joins us over the phone to respond to this issue. Good afternoon, spokesman Balenya. How is PhilHealth addressing its supposed slow processing of reimbursement claims by hospitals?
Well, Jess, good afternoon. PhilHealth remains committed to our partner hospitals. In fact, on the issue of turnaround time in our claims processing, on national average, PhilHealth has been paying on national average, mga some 39 days, for these claims. So, insofar as turnaround time is concerned, we are not that delayed insofar as payment is concerned.
Well, what are your next steps now? You have the palace ordering PhilHealth to expedite payments to private hospitals.
Yes, we have been expediting claims payments. Just what we would like to clarify in this issue is that what is being glossed over is the fact that a total of I'm sorry, I'm just looking at my data
Go ahead,
at the
sir.
moment. Yeah, a total of 84.27 billion has been paid by PhilHealth now, and that is in the span of 2018 to 2020. So that represents 92% of some 8.4 million claims now that we received from PHAPI member hospitals. And the truth is, there are now 1.14 billion that are still in different stages of processing. But what we would like to point out now, especially to our members and observers, is that some 5.6 billion have been returned, either returned or returned to the hospitals or denied payment. So we would like to point out that we have to return these claims to the hospitals because these claims are needing compliance now to rules of PhilHealth.
Again, sir, if I may clarify, they were returned on what account specifically?
Yes, they were returned because these claims are with deficiencies. No, for example, the required documents are unavailable, incomplete, inconsistent, or either inconsistent or unreadable. And some claims require more documentation, and we have noted discrepancies in entries in these claims. In particular, claim form 2 is not properly accomplished, and there are errors in the claim form 4. So, just some 2.5 billion worth of claims have been returned to the hospitals, and our appeal to our member hospitals is to immediately correct these claims and immediately return to us so we can act on this return to hospital claims.
Okay, given that, sir, you have PHAPI saying that their members now are actually forced to downsize operations due to the agency's failure to actually pay claims. Are you willing to hold a dialogue with PHAPI regarding this matter, and what solutions do you hope to come up with?
Yes, PhilHealth is always open to dialogue. In fact, just today, we had a dialogue with the Philippine Hospital Association, and one of the attendees was the president of the PHAPI. So we have always been open to dialogue, and in fact, this is one solution that we have been advancing since last year. Our president and CEO has directed all our regional offices to open up and conduct reconciliation of claims data so that we would be able to point out which claims are needing compliance and which claims are already in process and which claims are already denied. And so they don't have to include these claims in their receivables.
Okay. Sir Ray, if I may just go back to a point that you raised earlier, you did mention that you were able to pay as much as 845 billion pesos, but that is from a span of 2018 to 2020. But if we try to focus solely on the COVID-19 pandemic, how much has PhilHealth paid PHAPI?
Well, actually, my data now is a data covering 3 years, But I'd like to point out that overall, for 2020, PhilHealth paid all its accredited healthcare providers some 91 billion pesos, and that represents 84.7% of all the claims that were received by PhilHealth, and some 459,000 claims have been denied, while 653,000 claims have been returned to the hospitals. So you see, these claims are quite voluminous, and so the only solution here is really for our partner hospitals to be careful in their claims, because prudence will dictate that we have to return those claims if they are not fit for payment, if they are not, if they are with deficiencies, or these claims are not conforming to our standards.
Okay, sir, next question is PhilHealth also covering the expenses of COVID-19 patients staying in hospital tents? And what can you say about medical facilities supposedly charging as much as 1,000 pesos per hour for these temporary tents?
Well, we would like to again reiterate our statement that we earlier issued that if the services given to the patients now currently staying in tents are part of the inpatient care, then this should be covered by the current inpatient benefits of the program. So we would like to clarify lang that what was being referred to during that particular Congress hearing is that the stay of the patient in tents of community isolation units that are not yet accredited with PhilHealth. So if the facility is not accredited with us and we were referring to community isolation unit tents back then these are not compensable. But again, Jess, we would like to reiterate that not one should be left behind under the Universal Healthcare Law. And we are now reviewing our policies so that we should be able to provide clearer guidelines, all in the objective of providing adequate financial coverage for our patients, but of course without compromising quality of care.
All right, that's definitely something that we are going to keep tabs on. Do keep us posted. PhilHealth spokesperson Ray Balenya, thank you for your time, sir. Business groups are urging the government not to extend for another week the stricter quarantine status in the NCR Plus bubble. Dale De Vera joins us live from Quezon City for the details. Dale, what were the reasons cited by these groups?
Just the business groups are not in favor of extending the enhanced community quarantine in NCR Plus amid the rising or the surge in COVID-19 cases. However, they say they have no choice but to follow the government's decision at the moment. Employers Confederation of the Philippines President Sergio Ortiz said that they want the government to implement other measures instead of imposing stricter quarantine classifications. Among this are adding more rooms in hospitals and hiring more healthcare workers to deal with the influx in COVID-19 patients. Ortiz said that businesses are badly hit since last year, and another ECQ extension will cost them billions of pesos more. Meanwhile, labor groups are pushing for a faster release of cash assistance to workers. They say that most workers would opt for cash assistance rather than in-kind aid in order to pay for their bills. Labor groups also said that the 1,000 peso cash assistance is not enough for a family to survive even for a week. Just the government assured the public that the ECQ ayuda will be distributed starting tomorrow, but no additional assistance.
All right, thank you very much for those updates, Dale De Vera. Now, for more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Jess De Los Santos. We are One News.